So as I was driving to work this morning, it made me think about just how different this time is than other times as we start the school year. Mom was at the school bus stop, just like always, with her child, but this time he had a mask around his ear, not on his face, of course. But I could see she was intently telling him, make sure you wash your hands, make sure you use the sanitizer, do your temperature checks. All of these are things that we never thought we'd have to talk about going to school. And teachers, right? They're trying to make sure that they're balancing the virtual work as well as the non-virtual work, making sure they're being clear, protecting the kids, but they're still kids, and we all understand that. So we here at Inspira are committed to making sure that the school districts have what they need, the PPE, the masks, the sanitizers, all of those things to ensure your child's health. So while these may be difficult times, don't worry. Have comfort that we're here with you. So I know many of you are concerned about coming to the hospital for care or even coming to a physician's office for care. So let me just take you through a couple of the elements. First of all, this morning when I entered the hospital, the first thing they did was take my temperature. So immediately they knew that I was safe. There were sanitizers there immediately for me to wash my hands. And then secondly, when I came in with my mask that I wear at home, they gave me a new mask, which would ensure that I had the appropriate mask on, not the comfortable, soft one that I like to wear, but the one that actually makes sure that we're protected. As you walk around the corners, you see everywhere signs that show you just how far 6 feet apart are. There aren't a lot of people. You'll see that the seats are separated. But I want you to know that behind the scenes, we've done all of the things that we need to do to make sure that you're safe. We've created special rooms that have what we call negative pressure to make sure that just the right amount of air is in there and that air is as clean as possible. Our doctors and nurses have all of the access to the PPE they need. But let's say you don't need a hospital, but just a doctor. We have the doctor's offices set up in lots of different ways. You can go to your own doctor's office as part of our healthcare system. You can go to one of our urgent care centers. And again, in those situations, you just call the office and they'll tell you what the protocols are. In some cases, we have enough space that you can actually come and wait in the room, socially distanced. In other cases, we're going to keep you in your car and just call you in. So that way, at least you will know you don't have to be worried about being exposed to anybody else. And in the last condition, maybe you don't want to leave house at all. This weekend, I actually did a Inspira telehealth visit with my dad. At 91 years old, he needed that confidence of being able to have that quick answer about an infection, but be able just to get an antibiotic, and I was able to run out and get him for him. Lots of choices depending on what your needs are, but please know, most of all, we are here to walk this difficult journey with you during COVID, and your safety is always our top priority. Until we meet again, stay safe and be well.